It's been challenging in more ways than one, with lots of people still narrating their ordeal.
Coming to terms with this reality was never a stroll in the park.
It's 2020, a year of the pandemic. It was a bolt from the blue. It came quite unawares, like a thief in the night. According to the World Health Organization, the first human case of COVID-19, the disease caused by the novel coronavirus causing COVID-19, subsequently named SARS-CoV-2, were first reported by officials in Wuhan City, China, in December 2019.
While some of the earliest known cases had a link to a wholesale food market in Wuhan, some did not. Many of the initial patients were either store owners, market employees, or regular visitors to this market. It went on to say environmental samples taken from the market in December 2019 tested positive for the SARS-CoV-2, further suggesting that the market in Wuhan City was the source of this outbreak or played a role in the initial amplification of the outbreak. The market was closed on the 1st of January 2020.
Yeah, but amid the denial of its potential danger, it took Dr. Li Wenguan, who later died of the virus, to take the lead of the secret. He announced to the world that China was dealing with a dangerous infectious disease, the coronavirus. But before then, the virus had already begun to cross borders, killing thousands of people in the wake of the spread. By January 2020, nations began to shut their borders and lock down cities. Eventually, entire countries were shut down as the United Nations declared the spread of the virus, the deadly virus, a pandemic, and officially named it COVID-19. While some countries have succeeded in containing the disease's spread, others are now battling to curb its second wave. On February 27th, the NCDC's progression of COVID-19 cases in Nigeria indicate that 2 cases were found in Ogun State, and almost immediately, cases in Lagos surged to the top of the log. The FCT wasn't spared either. Then, other states, including Kano, which at some point overtook Abuja, and then Oyo and Gombe. Incidentally, when Plateau State increased their testing, they surged above Oyo State in a number of confirmed cases. The cases then oscillated from one state to the other. Eventually, the NCDC's confirmed cases in Kogi and Cross River states, the last states to confirm cases.
Let's give you a breakdown of some of the major disruptions due to the coronavirus pandemic. And we're looking at the number of deaths all over the world. Over 1.8 million have died from COVID-19. And we're also looking at some of the top countries that have been worstly affected by the virus. You can see here that the United States is number 1, followed by India. There's also Brazil, Russia, France, and the United Kingdom. About 193 countries are suffering from COVID-19. You can also see below as well that Nigeria have had its fair share, sadly, of deaths. We're looking at 1,278, and these are figures coming in from the Nigeria Center for Disease Control as at last night. Well, we take you to, indeed, the next slide. You can see that medical workers who have been on the front line in the battle against COVID-19 have also been affected, not to mention now that we're hearing of the second wave in many countries and possibly a third wave. Amnesty International found that over 7,000 health workers, and this is into the amber months, indeed, have died around the world after contracting COVID-19. Worst hit as at that time, because these figures have definitely increased since then. It's Mexico, of course, the United States is next. You have India, Brazil, and then in Africa, you have South Africa. Sadly, for a lot of the doctors, medical workers in the United States, a lot of them are immigrants and those referred to as minorities. Now, in Nigeria, the NMA very recently in December said that we have lost 20 health workers due to the coronavirus pandemic. Now, that's not all of the disruptions. There was also loads of sectors affected by COVID-19, and these are just a few: entertainment, construction, aviation, transportation, and education. But perhaps some light at the end of the tunnel, and that is with the speed that the vaccines came on, and we're looking at the Oxford University AstraZeneca, the Moderna, the Pfizer BioNTech, and the effectivity and the storage. Of course, you know that the Sputnik V, that of Russia. We also heard fairly today as well that indeed China has rolled out a vaccine against COVID-19. So all of these are some of the major disruptions that we experienced this year in 2020 due to the coronavirus pandemic. Some have referred to it as perhaps a war or even a national disaster. But the thing with those things are that at least you can relocate or perhaps even build a defense mechanism. But COVID-19, no, it's affected everybody in different parts of the world. Some people would like to forget 2020. I don't know about you. Let's find out from Chamberlain.
Well, the broadcast profession wasn't spared. Ordinarily, this seat here would have been occupied, but the COVID-19 protocols, which gave rise to social distancing measures, kicked in, and so we had to respect all of those. Well, here now is the first press briefing by the Presidential Task Force after the first confirmed case of COVID-19.
Welcome to the first.
It's the first press briefing by the Presidential Task Force on COVID-19 in Abuja since it was inaugurated by President Muhammadu Buhari on March 17 this year.
Chairman of the Presidential Task Force.
Secretary to the Government of the Federation, who is also the chairman of the task force, highlights the government's economic sustainability plans.
Mr. President has today approved the constitution of an Economic Sustainability Committee to be chaired by His Excellency, the Vice President. That Mr. President has also approved the exemption of the financial services sector from restrictions to allow skeletal operations in the financial system and the money market in order to keep the system in light operations during this period.
Next is the Minister of Health, who gives updates about the current status of confirmed cases and how the government is managing the spread of the virus.
Till date, 3 persons have been discharged after successful treatment, but sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts.
The minister also highlights what the government is doing to scale up testing and treatment capacity.
The NCDC has expanded its capacity by engaging hundreds of ad hoc staff to support various areas of response, including the call centers, contact tracing, and follow-up of persons of interest. On the order of His Excellency the President, all retired but essential and able-bodied staff are to be recalled to service at this crucial period. In addition, training is being conducted for medical personnel to support overall preparedness and response activities to prevent the virus from spreading further into other states.
How exactly is the government
fielding answers to questions from Channel's reporter on how the government intends to cushion the effects of the total lockdown on citizens? The Minister of Humanitarian Affairs has this to say.
Let me also reiterate here that because of this COVID-19, the vulnerable groups have to be expanded because we are aware that we have people who live on daily wage. And so we're also going to look at those groups of people to see how we can take this food relief intervention to them in these affected areas.
There are currently over 100 cases of COVID-19 across 12 states in Nigeria, with majority of the cases in Lagos and Abuja, just as states across the country enforce a lockdown to prevent further spread of the virus to other parts of the country.
We also have a background of President Muhammadu Buhari's decision and indeed subsequent announcement of the lockdown. Our correspondent Oroluwa Shonibare packaged this report.
We are therefore working to ensure such interstate...
The necessary call by President Muhammadu Buhari to contain the spread of COVID-19.
Based on the advice of the Federal Ministry of Health and the NCDC, I am directing the cessation of all movements in Lagos and the FCT for an initial period of 14 days with effect from 11 p.m. on Monday, 30th March 2020. This restriction will also apply to Ogun State due to its close proximity to Lagos and the high traffic between the two states.
At first, it was hard for people to make the adjustment, and obedience to social distancing was widely disregarded. But the daily rise in number of cases, as revealed by the NCDC, set off alarm bells to the reality of the situation. And before long, other states began shutting down places of gatherings and borders. At the end of the first 2 weeks, there was widespread apprehension whether the president would relax the order or extend it. The matter was laid to rest at 7 p.m. on April 13th.
It has become necessary to extend the current restriction of movement in Lagos and Ogun states, as well as the FCT, for another 14 days, effective from 11:59 p.m. on Monday, 13th of April 2020.
Soon enough, rumblings were heard again from pockets and stomachs of people whose means of livelihood became affected by the order.
We are hungry. We are trekking from one place to another.
Protesters demanded palliatives from the government. To them, this was a fair trade for not working. Security threats from hoodlums also spread, raising fears of looming breakdown of law and order. However, this was repelled by not only security agents, but residents who were not ready to give up the little they had without a fight.
Anybody come from anywhere, come from Abuja, come from Kano, just come down here and we bring you down to the lowest level. Am I good? Yeah.
The federal and state governments began distributing palliatives in food and cash to those regarded as vulnerable in the society. But regardless of this, many people still yearn for one thing: freedom of movement. But the rising number of cases and deaths from COVID-19 appears to be the only obstacle in their way. Oroluwa Shonibare, Channels Television News.
Well, joining us now to weigh in, reviewing the year 2020 as it has to do with the effect of COVID on all of us and the health sector. We'll start here in Lagos. We've got Dr. Olufemilayo Akinola, who is a chief psychiatrist heading the Oshodi Annex of the Federal Neuropsychiatric Hospital. Thank you for joining us today.
Thank you very much for having me.
And we also do have joining us via Zoom, Professor Oyewole Tomari, who is a professor of virology. He joins us via Zoom from Ibadan, as you may see there. Prof, thank you for joining us this evening.
It is my pleasure.
Okay, then we also do have Professor Innocent Uja. He is the president of Nigeria Medical Association. So you should see him as well via Zoom, but he's a bit mobile, so just hang on. You will, sooner rather than later. Well, we also do have Professor Isa Sadiq Abubakar, Director, Center for Infectious Diseases Research of the Bayero University in Kano. We've got one more. Millicent.
Indeed, Dr. Chinwe Ochu, leading prevention programs and knowledge management to the NCDC. She joins us from our Abuja studios.
Thank you for having me.
All right, great. Let's begin with you, Dr. Akinola, Chief Consultant Psychiatrist. I mean, 2020 for you, especially when we look at the health sector, what would you say was like the major highlight of 2020?
It was the COVID infection and, of course, the psychological effects, the effect on people,
Healthcare workers. Yeah.
Yes, workers. I mean, the effect was just global. Everything, it affected everything. The health of people, there was increase in rate of depression, anxiety disorders. Of course, people, then the fear. The health workers had the fear of catching the virus, taking it home. And, people didn't want to attend to patients because of the fear. So it was quite, shall I say, inverted commas, an interesting year. Very stressful year, but we hope the second wave won't be that bad, although they are saying it's going to increase, but we are hoping, we are keeping our fingers crossed.
We're doing the same thing, as a matter of fact. But could you tell us, what was it like for the patients? Because we already know that you have to handle them with care in terms of how different things go on there. So how did they react to this?
Yes, it affected them so many ways. For example, those that already had psychiatric illnesses, because of the lockdown, they couldn't access their healthcare providers. For example, those that live in Badagry, there was no way to come down. There was no way to buy. I had a patient that they couldn't get his anticonvulsant, so he started having breakthrough seizures again, and people couldn't come. I had one from Ota that, it started fighting, almost having going physical with his wife, because he kept on saying he'll be able to buy the medication where he lived, but actually couldn't. So then, of course, those are the people that already had mental illnesses. So, but now, the fear, the anxiety, am I going to get it? That created and there was a lot of increase in depressive states, anxiety states, and it was just unprecedented, and we really had to deal with all that. Then health workers themselves. So coming to the hospital, there was we had to put in a lot of barriers so that, we won't transfer it to the workers won't transfer it to patients. And so it was just a stressful year.
I want to bring in Professor Tomori, who's joining us via Zoom from Ibadan. And that is at the beginning, when what did we know about COVID-19? Looking at how it started in December, January, up to this point, we appear to have learned a lot about the virus, yes?
Yeah, I mean, over the months, the virus kept evolving and coming in different forms, and we're learning on a daily basis. So we had to keep ourselves on track of what was happening in other parts of the world, and learning almost like, it was like a learning curve every day because something else happens. It started in one type of symptoms, and then you learn more about it as time goes on. And I think one of the lucky things for us in our area is that the virus did not behave to type as was known as it was behaving in Europe and the Americas. And I think the virus put history to shame. It was usually assumed that anything coming into Africa was going to cause devastation. But this time, I think they were disappointed to our own happiness.
Well, Prof, I'm just wondering if I could just add to that. I mean, for virologists, first of all the health professionals, it was what a job they did and are still doing, and we all appreciate all of them, not just here, but wherever they are. But for virologists, did they see this as an opportunity for them to perhaps develop certain things? Because I know that, they are in some sort of front line about this one. How did they see it?
Yeah, in other parts of the world where the environment is conducive to good research, it was a great opportunity. Anything like this, which you call obstacles, are actually stepping stones to greater achievement. But that's in areas of the world where they are ready to take advantage of opportunities. We are not here because we have not created the environment for us to make use of the opportunities that occur to us from these so-called obstacles. And so we're just mostly behaving helplessly, watching as they unfolded and running after. We're not proactive as other parts of the world. We're, as I used to say, we are solving the problem of yesterday, tomorrow. And that's what is happening to us. And that's why we don't seem to have really benefited from this experience. We're a country or a region that learns from forgotten lessons. We operate on lessons forgotten rather than lessons learned.
All right, go ahead.
I was just going to say, we have Professor Innocent Uja, NMA president, who is driving. If you can hear us, and let's quickly ask you, and this is essentially for the Nigerian Medical Association, when COVID-19 kicked in its peak, how did the NMA suffer?
Well, as we all know, the COVID pandemic came to the whole world unprepared. And when it comes to Nigeria, Nigeria was worse prepared. However, fortunately, the president took the leadership and constituted the PTF very quickly. However, we think that the composition of the PTF was inclusive enough. But be that as it may, we as medical doctors now reorganize ourselves and ensure that we are committed to the containment of the national response of COVID-19, but not without its own challenges of inappropriate or unpreparedness of the government and stakeholders, like the provision of PPEs, like the issues that even led to the strike of National Association of Resident Doctors, where PPEs were not there, hazard allowance were not even considered, and it took the resident doctors, a decision to go on strike, and in fact they went on strike before there was a government intervention. But by and large, it was a very challenging. It has been a very challenging year, a year that is a total loss. I don't think we gained of COVID, which is not a gain; it's a disaster, not only to the health system, but the social and economic activities of any country. It has brought the whole world on their knees, Europe and America. Just like our very senior colleague said, Professor Tomori, it has shame to expect would happen. We expect that once, but we are seeing that the developed countries are worse.
All right, well, okay, Professor Uja, we do appreciate your perspectives today on the program. Professor Innocent Uja is the president of Nigeria Medical Association. Well, let's bring in Dr. Chinwe Ochu of the NCDC. I think it was some sort of mixed feeling on the part of your agency, I stand corrected, but could you just tell us, what did this do for the NCDC? Because we know that before now, well, yes, the NCDC always did its job, but a lot changed. Tell us about that.
Thank you very much. I'm happy that I have to look at the strengths, the positive aspect of this outbreak. And I'll be looking at it from the half-filled cup point of view. NCDC was established in 2011, and we had been battling to keep the nation safe from all the other infectious diseases of public health concern before the COVID-19 outbreak struck. For instance, before we recorded the first case of COVID-19 in Nigeria, we had just 5 laboratories, public health laboratories that can test for, molecular laboratories that can test for COVID-19, and only about 2 or 3 of them that were working and functional then. But currently we have 69 public health laboratories in the country across the 36 states and the FCT, and we have 31 private laboratories that have also joined the network, as well as 7 corporate laboratories. So that is a big advantage for us. What we could not achieve within 9 years, we've been able to achieve in 10 months. For treatment centers, when we had the first case, it was just Infectious Disease Hospital, Yaba Lagos, that was ready to admit. And the patient that was, the case that was detected from Ogun had to be sent to Lagos for admission. But currently we have over 100 treatment centers across all the states of the Federation. We have also strengthened our infection prevention and control system. Currently, all the tertiary health institutions in the country have established infection prevention and control committees. This is what we have been trying to establish over time, and it has not been that easy. But this year, we were able to get that done, and we're hoping that we'll scale it to the secondary health facilities and primary health care facilities as well. For risk communication, we had strong collaborations, and we've been able to develop a risk communication and community engagement strategy that is so robust. We've strengthened our collaboration, our partnership, private sector involvement in health. And this has made it so obvious that we now see people taking responsibility for health. We use that #take responsibility as the key strategy for our response to COVID-19 outbreak. This is the first pandemic we have experienced as a country, and this is the first time that as an agency we've had to respond to an epidemic in all the states of the Federation. For Lassa fever and all the other cases, you'll be talking about 3 or 4 or 5 states at a go, but now we had to respond to 36 states plus FCT. We had rapid response teams that we dispatched to all the states of the Federation to support the response. We've also seen the states taking a lot of responsibility with this pandemic. It's not been very easy to get the states to cooperate, but this year we saw a lot of political will by the state government, establishing treatment centers, setting up public health laboratories, and this is what we believe is going to support not just the COVID-19 response, but also our response to all the other public health threats that we're dealing with. Lassa fever is still with us, monkeypox, yellow fever, and so many others. So we really have cause to give thanks, and what we are looking forward to come 2021 is to be able to sustain the gains that we have made as a public health agency in 2020.
All right, Dr. Chu, we're going to come back to you, especially talking about some of the things that happened at the beginning, because some of the problems are still what we're facing now, just like testing issues and the likes. But I want to bring in Professor Issa Sadiq Abubakar, joining us from our Kano studio. And this is in the case of research. How do you think we've fared in 2020, looking at the infectious diseases while we're also battling a pandemic, COVID-19?
Thank you very much indeed. Research is one of the pillars of our National Strategic Development Health Plan. And of course, for several years, it has always been in our plan, but execution of such researches had been very difficult. Similarly, utilization of data that has emanated from researches had also been difficult for governments to use in formulating policies, or for the findings of researches to be used in decision-making or in improving case management in the case of diseases and other health problems. That is how it has been. But with the coming of COVID-19, a lot of groups have come up with a lot of research ideas in Nigeria. Some of them are in the stage of implementation. Some are still in the planning stages, and some few have reached the stage of even publication. Now, that means COVID-19 pandemic has brought some positives in the area of research, but then we still have a long way to go, because there are a lot of things that are yet to be known concerning the virus itself, the way it is transmitted. There are some answers that we need to answer. For example, people who have had the infection, are there chances that they may come up with another infection in the near future, or do they have long-lasting immunity? A lot of researches have come out from other parts of the world with people suggesting different things. So even in Nigeria, we need to identify such facts and then be able to take decisions based on them. Then the issue of treatment, which has not been found worldwide. People even here locally have made assertions that they have some preparations, some formulations that can be used to treat COVID-19. But such are subject to verification by researchers, which have to go through the normal process of the different stages of clinical trials to prove or to disprove their claims about treatment. Similarly, the issue of vaccine is another thing. Worldwide, we are witnessing the coming up with different vaccines from different countries, and we believe that even in Nigeria, we have institutes. For example, the institute that was headed by our president of the Nigerian Medical Association, Professor Uja, he headed the NIMA before he subsequently became the president of NMA. There are a lot of things that can be done in NIMA and NIPRID and other some institutes and some universities, research centers. So we need to work and identify some of the vaccines and some drugs that can be used to prevent COVID-19. So it has been a challenging year for the people, for researchers in Nigeria as well as other countries, that we need to work harder to find solutions to the various aspects of COVID-19. Being a new disease that is just being discovered and people are working across the globe, we in Nigeria also need to work harder to solve some of the problems for the world at large.
You know, Professor Sadiq, at the time, I mean, there was a time where there were certain scenario and reports that came through from Kano. Many weren't sure about what exactly it was. So at that time, a lot was hazy. So since you are of the infectious diseases, concerning how that was dealt with at the time and the capacity that your agency or institution has now, what can you tell us about what is going on now? Because those who still have mindsets, they don't seem to have some sort of closure concerning how that was handled, what can happen or what will happen with institutions in Kano if any such scenario plays itself out again.
Well, you know, it has been very difficult for people to confirm some of the sayings that we are witnessing. However, COVID-19 is one infection that spreads so easily that people need to identify the various means, known or unknown as of now, so that we can improve on the preventive measures. And a lot of researches need to be done to find that. We are doing some minor researches here and there, but then we need sophisticated equipment to do better in our researches in Nigeria.
All right, then let me bring it back to Doctor here, because, you know, even before COVID hit, in terms of handling cases with the patients that you deal with, there was still a huge gap. I stand corrected. So now that COVID happened, are you happy? Are we paying the right attention? Because so many people suffered so many things, mentally, psychologically. In terms of the capacity of those institutions in the country, are we paying attention to it? Have we improved capacity? Are you happy with what you've seen? What would you like to see?
Oh, well, I want to say that definitely we need to increase the capacity more, you know, because right now, you know that there's a lot of migration going on in the medical world, the doctors, the nurses, they are all migrating out. So there's a huge need because of post-COVID session. There's, like I said earlier on, it has even been documented now in research that some people after having COVID-19 infection, they now come down with psychiatric illness, frank psychosis. So there's a lot of work to be done. So we need to increase our capacity and, the access to people so that they can come. But, everybody have to put barrier, the PPE, so that, you don't want to take it home too. But there's a huge need out there. And we need to increase our capacity. There's no doubt about that.
Professor Tomori, I'd like to bring you in, and this is looking at several other diseases that, we also experienced in Nigeria, apart from the mysterious deaths. Take, for example, the Lassa fever, yellow fever, and there was, of course, the good news of the wild polio, where we were declared free sometime in August. Looking at how, 2020 has gone by, how would you describe how our efforts towards those other diseases and the success of being free of wild polio?
Thank you very much. I quite like my colleagues for their optimistic outlook to what is happening in the country. But in the reality of it, let's be frank with ourselves. We have not done well. Let's be frank with ourselves. I remember when Chikwe came up, at the beginning of the year, I was talking about building labs, and I said, yes, Chikwe, I don't envy you. I admire the efforts you are putting, but you should not be building labs now. We're 60 years of independence as a country. We had labs in this country that were functioning before. What happened to us? Those are the most important lessons here that we need to learn. This is not the time for us to be building labs. This is the time to be using labs that have been built and sustained. And so, I think we need to be very, very careful. I like optimism, but I also like being realistic. So it's about Lassa. Lassa fever has been with us, 50 years, if I remember. And if you look in the last 3 or 4 years, every year we have had more Lassa fever cases reported than the year before. I think in 2019, we thought that was going to be the largest number. But the following 2020, the number went up. Following 2021, the number went up. And again, people always want to play things in the type of positivity. I was told, it's because people are now becoming more aware, and that's why we're reporting more cases. But NCDC was set up not to report cases. NCDC was set up to prevent cases. I think those are the issues I think we begin to look at what we're doing as a country. More cases, now yellow fever is all over the place. It's coming into so many other places. When people were saying this is the first time we're dealing with pandemics, that's not true. We had pandemics of yellow fever back in the 70s, in the 60s. I remember between 80 and 91, we had yellow fever all over this country. The laboratories that did that, this was done in Ibadan here. We didn't have to go to Dakar to confirm our things. Why are we moving backwards? These are things I think we should take the opportunity of this to look back on those areas. I like our colleagues, let's paint the positive side, but at the same time, let's be realistic. That in 60 years, we are where we are because we have abandoned the things we should do. We have not sustained what we have. And I think we need to, we like funding to our government. The other day, I was at a meeting when one of the ministers got up and said, COVID is killing everybody in Europe. It's not killing people in Nigeria. It must be what the government is doing. And I got up and said, yes, COVID is killing in Europe, but your deduction that it is what we did right is wrong. It is what the virus has not done. That's why we are not having the problem we're having. We have not done the right things. COVID is new to everybody in Europe and everywhere. They are learning as we are learning. The success they have made there, we can't compare it to the success we have made here. Because the environment for our colleagues, I think it is important for you, our colleagues, let's tell the truth to the government. Let's speak truth to power. Unfortunately, power in Nigeria is death. So I think it's time for us to empower truth and move a step further. And all these fancy things we are saying, we're doing, government is doing that. We should stop it. Let's talk the truth and tell the government what it is. Take the issue of risk communication of information to people and getting awareness to people. Are we aware in this country? You see, people are still, in fact, in my state today, they're going to do a crossover service. And the governor just quickly canceled the, whatever you call it, the curfew that is set up. And then because he wants to pander to the religious group. And now people are going to go out and have this. These are the issues we're talking about. Our governments are talking incoherently. Kogichi says they don't have any COVID. Cross River has the same type of thing. Some of the states, no, they're not testing. We know that. But we're not telling these things to the people. They get them $1 billion to test, to treat, to this. How many of them are testing? My friends, let us talk and tell the government the truth, because they depend on us to tell the truth. And if we are pandering to them, they will never know what is right.
All right, Prof. Well, you heard him. We'll explore that a little further when we return in just a moment. Stay with us.
Some people in the state still don't believe the reality of the virus. Now, Channels Television has been allowed access to Muhammadu Buhari Isolation Center in Giginu, and who you can see here are positive patients of COVID-19 who are receiving treatment in this isolation center. On April the 11th, 2020, Kano State recorded its COVID-19 index case, and since then, the figure of confirmed cases has been rising rapidly, making Kano the second high-risk state with over 900 positive cases at the moment.
We look at our face to make sure that everything is bad.
Before now, this woman says she thought the story on COVID-19 was all lies, but that has changed.
COVID-19 is real.
Of residents to subject themselves to test.
So far, we have been trying to do our best to manage those patients that we have, and we have discharged a lot of them within the last 2-3 weeks.
Today, Kano State has tested over 4,000 samples. 970 are confirmed positive, 639 are active, 45 deaths recorded, while 286 patients have been discharged from various isolation centers across the state. From Muhammadu Buhari Isolation Center in Kano, Idris Jubrin, Channels Television News.
Extreme ethnicity, corruption, mayhem, outlawry, impunity, murder, ritual killings, kidnapping, whatever. The malaise which has assailed this nation is a hydra-headed monstrosity which we created ourselves. And anybody who sits at the center and thinks Nigeria can be tackled centrally is living in a cloud cuckoo land. It's not living within Nigeria. This nation can be saved only if it begins with the realization that we brought the disaster on ourselves with over-centralization. The first step this nation has to take is to decentralize so that the various parts can go back to being healthily competitive within their own means, choosing their own priorities, applying their resources to the immediate priorities of their own zones.
So the special program here on Channels Television 2020, the year of the pandemic. We're speaking to our various guests, of course, at Ibadan, Professor Oyewale Tomori, Dr. Chinwe Ochu in our Abuja studio, Professor Issa Sadiq Abubakar, and of course here in Lagos, Dr. Fumilayo Akinola. I'd like to continue with Dr. Chinwe Ochu, and that is responding to some of the things that Professor Tomori talked about just before we went on the break. And I mean, a few of what he has said is that it appears we're not telling the government the truth. And I know that I've taken a look, I've received a lot of the incidents reports from the NCDC, and one of the recurring problem has been that the trust in government. The people's trust in government has been affecting the messaging of the non-pharmaceutical protocols and others from the NCDC. So respond to some of the things that you heard Professor Tamori talk about, and perhaps this in line with our review of the year 2020.
Thank you again, Millicent. I sincerely appreciate our senior colleague, Professor Tamori, for all those challenges that he has brought out. These are challenges that we're dealing with as a nation and that had been with us even before the COVID-19 outbreak. As much as we would like to look at those challenges, which we'll be bringing out also in these discussions, it's also very, very important that we acknowledge the great efforts that went into responding to this outbreak and the various achievements that we have made as a nation. Let's face the facts. We have a digitized surveillance system that was scaled to several states in the country during this outbreak. That is an achievement that we should applaud. And Nigeria as a country actually was very proactive in some of the measures we took during this outbreak. Right from January, when after China announced the strange virus, we started preparing. That was when we did a risk assessment. With that risk, from the result of the risk assessment, we set up a national coronavirus preparedness group that was multi-sectoral and started preparing for this outbreak. A lot of gains. And we instituted most of the public health and social measures even before other countries like the civilized world. Yes, we may not be where we want to be now, but we should always look at the baseline. Our baseline may not be the same as the baseline of those other countries, but how far have we moved from the baseline? That is what we're looking at. For sure, like you said, Millicent, there are challenges. For risk communication, we know that government distrust is a big issue, and that did not start with NCDC. That has been a problem that has lived with us over the years due to all the events that have happened with the government. So people find it difficult to trust the government even when the government is saying the truth. And that was what helped us in developing a strategy around that. Another challenge we had was also the COVID paradox, which Professor Tamori also referred to when he was talking, where you see Africa not having the same kind of impact as other countries of the world. We're not having the same kind of, we're having fewer cases and fewer deaths. So people feel they are not threatened. Community risk perception is very low. So with all those, telling people now to adhere to these public health measures becomes a big challenge. These are some of the issues we are dealing with. And once these challenges are identified, the important question to ask is, what efforts have we made to address these challenges? For the community, low-risk perception in our communities, we have strengthened our partnership even at the community level. We have worked very closely with our traditional leaders, religious leaders, making use of opinion leaders and those that we call trusted voices that people trust. We've seen ourselves moving from that top-down approach to risk communication to a bottom-up approach where the community themselves are engaged to develop their own risk communication messages and pass it across. Yes, we have challenges, but we are moving forward. We are progressing, and we are hoping that all these gains, because if we're able to identify the gains from 2020, we will now work towards sustaining these gains. And let me also correct, just a little correction, that yellow fever outbreak of, the one that happened in all the states of the country did not happen when we had NCDC. This is the first time NCDC is having to deal with a pandemic that affected every state of the country. And this is just an agency of about 300 staff. And we had to deploy rapid response teams to all the states of the Federation. So I think at a time like this, the last day of the year, is a good time to commend the efforts of the dedicated staff and workers who have given themselves to ensure that this nation is kept safe.
Let's go to Dr. Sadiq Abubakar in Kano, and this is perhaps maybe your concluding thoughts on all that we've been discussing, and perhaps would also like you to weigh on the non-pharmaceutical measures, because we know that we're still going to be living with the virus. It's the new normal into next year, 2021. What do you expect that the government and the agencies, the Ministry of Health, also that of the state, the subnationals, should be doing moving forward?
Okay, you see, fighting this pandemic is kind of easy, but then that will be possible only if all stakeholders get up to really do what everybody is supposed to do. By this, I mean the government, the health workers, traditional institutions, religious leaders, as well as individuals. Everybody must see to it that the non-pharmaceutical preventive measures are the key, especially in our environment, because we have difficulty in accessing the vaccines, being the other tool we have at our disposal to fight the pandemic. So we have to work very hard to ensure that everybody comes forward to help in fighting the pandemic. So the non-pharmaceutical measures are very easy to practice, but if everybody complies with the directive, we need to intensify on our hand washing practices, the use of hand sanitizers. We need to de-emphasize large gatherings. We need to improve on our cough and sneeze etiquettes. We need to ensure that people who are ill get assistance from the health sector in good time. And that is when we will be able to reduce the number of people who are infected that can easily transmit these diseases to other people. It is when all of us play a part that we will be able to reduce the rate at which the number of cases are increasing. The government must assist people who are willing to partake in preventive practices. Government must be able to help people to ensure that there is adequate water supply so that the hand washing practices will be possible. Government needs to help industries that are willing to manufacture the hand sanitizers, our face masks, so that people will get it at an affordable price and be able to use it. And then we have institutions, our places of work, our schools that are about to resume, especially with the resumption of ASU, back to work, back to classes. One very big problem, one very big challenge that the universities will face is the inability of the universities to provide facilities for physical and social distancing. This is going to be a huge challenge, and I'm sure that the vice chancellors of various universities are now trying to find solutions which are not going to be easy to come by. But then we must find a way, because we have to continue with our education, with or without, in the presence of COVID or not. All right. So, as I said earlier, I still maintain that it's going to be easy, but if everybody plays a part. All right, our traditional institution must help.
Okay, Prof, we hear you quite well, but we need to bring it back here as well. Dr. Akiola, there's this debate out there as to, because clearly we're not out of the woods, the vaccines. Some think, well, we may not. Even the NCDC themselves think, look, it's going to be a challenge convincing people to take it. What do you think?
Well, I want to agree with you. It's going to be a challenge, because the first thing is people don't even believe the COVID-19 infection is real. So how are you going to convince them to take a vaccine for something they don't believe in? Then there's a lot of information going on the social media about, Is it real? Is it correct? The side effects of the vaccines. So people are just not there. They don't want to take it. And it has a lot of religious connotations too. So there's a lot of misinformation, information out there. So really, if the government wants people to take this vaccine, they really have to make a stand and tell, the public the truth. And many people don't keep to the rules because, number one, they don't believe that it is real. And they do not understand all this physical distancing, putting on your face mask. So you should not stay in a room. Well, they said it's 50% capacity, but that's not the point. The point is you should not be in a room that is enclosed, because if anybody has it in there, that means the virus is in the atmosphere, so anybody can catch it. So it's not just that you should have 50% capacity. It shouldn't be enclosed. The windows should be opened. So now physical distancing, put on your face mask. You want to cough, like I said, you cover. All this, we need to keep saying it. And they say how many people actually watch TV? But many people listen to the radio, that I know. So we need to do more about this knowledge. So we tell people, go, where are they in the marketplace? People don't believe. You go to the market, they will tell you, there's nothing like COVID. All of us in this market, nobody has had COVID-19 infection. True. So how are you going to convince them that they need to do physical distancing and put on a face mask? So the government really has a lot of work to do about education. We need to go down there and let people know.
So perhaps a difficult task, and this is going to you, Professor Tomori. Is this a huge task for the people, for the government, those who are in charge of a lot of this? Your conclusive thoughts on this.
Yeah, talking about vaccines is going to be a terrifically difficult task. And the reason being that up to now, our government has not come out to counteract all of this. What you find on social media is the wrong information about vaccines. By now, our government should have put out something on question and answer, which they give out on a regular basis. I was just telling, and your station, everybody, I was just saying to the NT, I said, instead of telling me that Buhari went to Daura, the first news should be question and answer about vaccines. Let the people know what the vaccines are, what are the real stories they are telling, and all those kind of things. So they get the information, which allows them to do this. Because if they don't give that information, all they are hearing is what on the social media. We are not proactive enough. We are thinking we'll get the vaccine in January. We are still not started talking to our people about what the vaccines, what are all these stories about vaccines. So I want to clear one thing. Our younger colleagues learn from history. It is okay for NCDC to be sending response team to all the states. In those days, states were the ones that were dealing with their own problem. And they only called on federal when there was need to. Why did we do it? These are the things I think on history will tell us. And what NCDC and others are doing now, you are covering up the errors of the past. When in actual we should have gone there. States were doing their things in those days. And the federal only got to know when they couldn't handle it. That's the direction we should be going. And that's the point I'm trying to make. Well done, the NCDC, and for all the great things you have done. But you are catching up on the failures of the past, which is not your fault, but the fault of the country. And these are measures, I think, that I said, let us talk truth to our government, so that we know where they made a mistake, where we ourselves who are addressing them are making mistakes, so that we can get this country to where it should be. I'm talking with confidence because I grew up in this country and I knew what we were doing in our time. I didn't leave this country for any study anywhere, but we trained our people here, we did our things here, states were doing what they were doing, but they only came in at the last moment. Right now, today, you heard what Shoyinka was saying. Over-centralization of everything. It affects everything we're doing. We need to get back to that place, equip, empower the states to do their own problem. And then federal can do much better at supervising that they're doing instead of NCDC running helter-skelter all over the country.
Well, we do thank you for your thoughts, Professor Oyewale Tomori, Professor of Virology, joining us via Zoom from Ibadan. Well, we also did host Professor Innocent Uja, who is the president of the NMA. He also joined us via Zoom from Abuja. And then Dr. Chinwe Ochu, leading prevention program and knowledge management of the NCDC. She joined us via Abuja studio. We equally had Professor Issa Sadiq Abubakar, Director, Center for Infectious Diseases Research for Bayero University. Join us from our studios in Kano. And then here, Dr. Olufemilayo Akinola, Chief Psych Consultant Psychiatrist, heading the Oshodi Annex of the Federal Neuropsychiatric Hospital. Thank you very much indeed for your time today.
Thank you for having me.
All right, and so we will be back in just a moment. It's 2020, a year of the pandemic.